Hello, my name is James Parton, and for my final presentation, I will be discussing causes and effects of post-traumatic stress disorder. First, let's talk about what PTSD is. It's a mental health condition that can develop after someone experiences or witnesses a traumatic event. We'll be talking about the events here in a minute, but key symptoms can include intrusive memories. These can come in the form of flashbacks, nightmares, distressing thoughts or emotions. I think when people think of PTSD, flashbacks is one of the first things that come to mind. Symptoms can also include avoidance. An individual will oftentimes avoid places or people or the situations that the events occurred or remind them of the trauma. They also might avoid discussing the event entirely. Another symptom is negative changes to thought or mood. They may feel detached. They can also feel guilt about the event, shame, hopelessness, or a loss of interest in things that they once found enjoyable, hobbies, friends, going out, things like that. They might feel a loss of interest there. And then one of the final symptoms is arousal. They're oftentimes easily startled, excitable, trouble sleeping, might even be irritable. Um, like we said, PTSD starts from an exposure to trauma. Some of the common ones are things like combat, chronic abuse, children who are raised in abusive homes, spouses in abusive relationships can oftentimes develop PTSD. Interpersonal violence, people who witness murders, aggravated assaults, people who are assaulted, sexual assaults, traffic accidents, natural disasters. One of the key aspects of these exposures is the time frame in which the event occurs. You're at much higher risk of developing PTSD if the event is repeated or is prolonged. Things like combat, people who are in combat for long periods of time are a much higher risk than someone who lives through an earthquake. There are also individual vulnerabilities. The first is genetic predispositions. Um, the other is prior or concurrent mental health issues. If someone has a mental health condition and they go through a traumatic event, they're at a greater risk of developing PTSD. Neurobiological factors, HPA axis dysregulation, how the body handles stress. If there is, some issue with that process, you're vulnerable to developing the symptoms. And also, a reduced hippocampus is oftentimes seen in individuals with PTSD. Also, in hyperactive amygdala, hippocampus is the memory portion of the brain, and then or one of the things it handles, and then the amygdala is fear. So you're oftentimes going to see a higher or more enhanced fear response from somebody with PTSD. Environmental social factors. So one of the things that has been found is that people who live in homes and have relationships that are loving and supportive, they're at a reduced risk for developing PTSD after the event of a trauma um, than those that are not in those situations. And then cognitive and psychological processes. So, what you do after a traumatic event also plays into that quite a bit. Maladaptive coping strategies. I'm a police officer, and we see a fair amount of trauma on a daily basis. And one thing that I have experienced personally is that the tools that you use to take care of yourself after a traumatic event greatly increases or decreases your ability to cope with that situation. Some of the maladaptive strategies that are often associated with PTSD are substance abuse, um, denying and hiding the event, not willing to talk about it. And so those are all things that make an individual more or less vulnerable towards developing PTSD. So societal and functional implications. So what happens after um, this mental health condition is developed? From an individual's perspective, you have psychological distress. Those symptoms we talked about earlier, there are physiological consequences as your body uh, becomes less able to handle the stress hormones. There are also physiological complications. Cardiac events, things of that nature can creep up. High blood pressure, even heart disease and diabetes, things like that are all connected with dysregulation with stress. Impaired social and occupational functioning. Somebody who is going through PTSD symptoms have a hard time functioning within society, functioning within their families. Um, and, they have a hard time at work, not able to do their job, tardy, late, not showing up at all. And then they're also at an increased risk for substance abuse, homelessness, and a risk for suicide. So, like I said, one of the things people use to cope with these situations is using alcohol, drugs, to combat some of the feelings that come along with that. And those things all go together to create a situation where individuals oftentimes find themselves in homeless situations. They are at a higher risk for suicide. From a society standpoint, an individual going through PTSD is going to have marital issues, impaired family functioning. They're going to have a hard time communicating and dealing with their family if they're on edge all the time, irritable, not willing to communicate. That's going to have a profound effect on the family. It could even induce secondary trauma into the children. An individual who's going through PTSD because of a traumatic event can create trauma based on how they handle that around their children, to their children. And this creates an increased burden on society with healthcare costs, dealing with individuals who are in crisis, police, fire, ambulance, paramedics calls, all that stuff. Um, you know, One of the things we see quite a bit of is suicide. And unfortunately, somebody going through a traumatic event and not being able to handle it, ending their life, creates a traumatic event for the officer and the medical personnel that show up on scene. And you almost have a cascade event. So, in conclusion, a PTSD is a multifaceted condition resulting from complex interactions among traumatic experiences, individual vulnerabilities, and environmental factors. One thing that's important to note is that understanding the causes and effects of PTSD is critical for prevention, early intervention, and effective treatment. Um, we need to be more aware of these causes so that we can hopefully help individuals that are dealing with it. Thank you very much.